Hello, and thank you for joining today's telephone town hall with Congressman Roger Williams. During the call, Congressman Williams will be taking questions from a number of folks on the call. If you would like to ask a question, please press 0 at any time. Again, if you would like to ask Congressman Roger Williams a question during this live telephone town hall, please press 0. With that, I'll turn it over to Congressman Roger Williams.
Thank you, Brittany, and I want to thank all of you for being on the call tonight. I want to also say what an honor it is to serve you in the United States Congress. And tonight you'll join a discussion on the state and federal response to the coronavirus. I especially want to thank my friend Dr. John Hellerstedt for being with us tonight. Dr. Hellerstedt is the Commissioner of the Texas Department of State Health Services, and I'm grateful that he's taken his busy time tonight to help us answer some questions regarding the latest on Texas's actions to combat the virus. So diving right in here, there is no getting past the fact that we are living through unique circumstances and uncertain times, but we will get through it, and we'll get through it together and get through it together as Texans. To give a little bit of background, the United States health officials found out about the virus on the last day of December 2019, which originated sometime in November in China. We've come to understand that the virus spreads easily, and in order to prevent further spread, we've all got to do our part. The Centers for Disease Control, or CDC as we refer to them, recommends washing your hands with soap and water frequently, disinfecting used surfaces, and staying home right now unless absolutely necessary. Over the last few weeks, I've received a lot of questions about what Congress is doing to respond, and I want to give you a brief update on actions from the federal government. At the beginning of March, we passed an $8.3 billion emergency funding bill that provided funding to address the virus here at home and abroad. This includes funds for vaccine development, purchasing essential equipment and supplies, and assisting state and local health departments. Congress also passed the Families First Coronavirus Response Act to help stop the spread in our communities, which was signed by President Trump. We recently took drastic action by passing the largest funding package in the history of our country in order to make sure our economy rebounds as swiftly as possible from this pandemic, and I believe that it will sooner than later. The CARES Act, C-A-R-E-S, the CARES Act includes relief for almost every business in the country in the form of financial assistance through government grants, low-interest loans, or simply tax relief. And within the next few weeks, a one-time cash payment will go out to most Texans to provide help with immediate expenses. On Friday, the Department of Health and Human Services announced that almost $2.1 billion was being distributed to 24,307 Medicare-enrolled health care providers in Texas, thanks to our bill. I was proud to join my colleagues calling for our rural health clinics and rural hospitals to receive funding available to small businesses under the CARES Act. And it is of the utmost importance that these rural health providers receive the support necessary to combat the toll of the virus and continue serving Texans. Your safety and your health will always be my top priority, and I've been working with the Trump administration to use every resource at our disposal to keep the 25th District healthy. President Trump declared the state of emergency for our nation, which provided $50 billion in much-needed resources to our state and local officials. The President also has temporarily waived interest payments on federal student loans, extended the tax filing deadline until July 15th to give added flexibility to filers, and given all Medicare beneficiaries access to telehealth coverage so they don't have to travel to their health care facility. The Federal Emergency Management Agency, or FEMA as it's known, has delivered 300 million gloves, almost 8 million masks, and 3 million gowns over the last week to healthcare providers across our nation battling the coronavirus on the front lines. And so far, the United States has tested and given results to over 1.7 million people. While there will always be disagreements, it's called politics, we are working together to protect Americans. This is a serious threat, but we will get through it, and we'll get through it together. In Texas, Governor Abbott has declared a state of disaster in Texas and activated the National Guard to stand ready to assist our communities. This means they are available to help with things like organizing supplies at hospitals, directing traffic at testing sites, or anything else they're asked to do. I've spoken recently with some of our mayors and judges here in the 25th District to update them on the situation in Congress and hear what is most beneficial for our communities in response. Rest assured that we are all working together to protect our families. So I encourage everyone to visit my website at williams.house.gov/coronavirus for more information on preventive measures, resources for small businesses, and assistance for the 25th District. You can also call my Cleburne office at 817-774-2575 or my Austin office at 512-473-8910 with any questions. I want to take a moment to thank any healthcare professionals or first responders here with us today. We know you're on the front lines of this response, and we are very grateful for your dedication and commitment to helping our families and our neighbors. I simply say a big, big thank you. Let's all remember that we need to be aware and not afraid, and we need to do our part to prevent further spread throughout our communities. So thank you again, Dr. Hellerstedt, for joining us today, and to all of you on this call for participating. So with that, Doctor, would you like to share a few words?
Absolutely, Congressman Williams. Thank you very much. I think you said it right. We are really in unprecedented times. Sometimes I wake up and just to look around and say, holy cow, I didn't really see this coming. And I'm sure other people have the same feeling from time to time. But we will. We're in a fight. We're in a war. The governor himself has used that terminology, and I think it's apt. But we can see evidence that we are turning the tide, and I think that's very important. We should be hopeful. We have made, as Texans and as Americans, great sacrifices in the form, especially of social distancing, in order to decrease very dramatically the rate at which COVID-19 spreads in our communities. And we can see from the information that we have, the data that we have, that we are in fact doing that. And we're doing it, if you will, at a rate and on a curve that is similar to other states and other countries in the world that are being successful at blunting that curve. So what is social distancing exactly? Well, it's about the number of times you come in close contact with another person close enough to spread a respiratory virus. And those respiratory viruses are very common. They're the things that cause the common cold. They're the things that cause influenza. In this case, it's COVID-19. And generally, you have to be within about 6 feet of another person for 5 minutes or more at a time. That would be considered close contact when it comes to a respiratory virus. So by decreasing the number of times that we come in close contact with someone like that in a day without any protection, so not even counting in the face coverings or gloves or some of the things that you see people adopting, without even relying on that, just by the things that we've done, we've seen a decrease in what's called the doubling time of the virus. So we started out, we were like some other states and countries. So for instance, in Italy, when it was at its worst, their doubling time was 2 days. And that meant that every 2 days, there were twice as many cases of COVID-19 as there was the 2 days before. And then 2 days after that, there were twice as many cases again. And you can see that really multiplies, that compounds pretty quickly. Over time, Texas started out at around 3 days, and now we're down to about 7. And the larger number is good. So instead of having the number of cases double every 3 days or so, we're having them double every 7 days. That's good, but it's not enough, I don't think, because you got to remember it's sort of like being in a car and putting your foot on the gas all the way, the gas pedal to the floor. You're accelerating as fast as you can, and that's what happened in the beginning. Right now, what's happening is we're letting off that accelerator, so we're still moving, and we're still moving kind of fast, if you will, but at the same time, that rate of acceleration, the acceleration is slowing down, and just like taking your foot off the gas in a car, eventually you're going to stop going faster, and you're going to start going slower, and that's really what the peak is that people talk about, and we really want to see that peak very clearly displayed in the rate at which it's spreading in our culture before we can say, well, now we've got an opportunity to look at social distancing and to look at other kinds of measures that can, again, help people get back to work, help businesses and stores and retail and all the different things open up again. So I'll stop there. That's really kind of COVID-19 in a nutshell. You said it earlier, though, too. There's the social distancing. There's also, if you will, the personal hygiene type of things, wearing cloth face coverings in public. We're doing that a lot in my neighborhoods and where I go shopping. Hand washing, can't beat hand washing, just like our doctors and our grandmas have been telling us all the time. And then disinfecting surfaces, particularly if you're in a surface where other people have touched it. It's great to have something to clean it with at the very least and something to disinfect it with if possible. We call COVID-19 a novel virus for the reason that it has never circulated in human populations before. And that means that there's no human population that has pre-existing immunity. And when that's the case, you see what happened in China and in Italy and other places. It can multiply very, very rapidly. And that's the thing we do not want to have happen in America or in the state of Texas, because it could happen that so many people at one time would get it. There'd be so many people who were sick enough to be in the hospital that we wouldn't have enough hospital beds and we wouldn't have enough ICU beds. We're way below that level right now in Texas. And if we keep the pressure on, if we keep fighting COVID-19 as effectively as we have, we're not going to exceed the ability that we have to take care of people when they get sick. And I know that has been the governor's number one priority. But as we, think of it this way, look at what it took to push back on COVID-19. We had to push back really, really hard to even get where we are today. And so that just tells us what a powerful enemy that disease is. And I just want everybody to know that there's reason to be hopeful in the future. The things we're doing are working. But just like any other war, you can't stop fighting until the war is won.
Well, thank you. And again, if you have a question for Congressman Roger Williams, please press 0 and we will get you in the queue. Now let's move on to our next call, or our first caller. It's going to be Joshua from Austin, and he has a question about government assistance. Joshua, you are on the line with the Congressman.
Hey, Joshua.
Hey, Congressman. Thank you for taking my question. I was just wondering if all of this government assistance is really necessary. I mean, do you think it crosses the line when we're told that we can't go outside or when businesses are being forced to shut down?
Well, that's a great question. We haven't had that ever happen in our country before, but this is a serious healthcare crisis we got, and it's a healthcare crisis, not a business crisis, and people are still testing positive and deaths are still rising. And I think if we didn't shut down major parts of the economy and have people stay at home, we risk having our healthcare system overrun. And I'm a small business owner like many of you on the line, and we didn't like it, but I think it might have been necessary. And since our workers and businesses have been hurt, we need to ensure that we'll have the resources to get through this short-term crisis. So that's why I'm working around the clock with my colleagues in Congress, the administration, our state and local officials to make sure people have the support they need, and it's beginning to happen this week. We're starting to see some cash infusion into the economy and our small businesses.
Thank you. Again, if you have a question, please press 0 and we will get you in the queue. Our next question comes from Tricia in Austin, and she has a question about help for smaller hospitals. Tricia, you are on the line.
Hey, Congressman. First off, I just wanted to say thank you so much for taking the time for this call. We all really appreciate it. I was just wondering, what are you doing to help rural hospitals, since a lot of them don't typically have all of the resources that these larger hospitals have?
Well, that's a great question, and our district has many rural hospitals, and I absolutely share your concern for the hospitals and the health clinics in our district and everywhere. They provide life-saving care for our communities and are facing catastrophic challenges right now. And I just recently wrote to Treasury Mnuchin and Small Business Administrator, this SBA chairman, calling for rural health clinics and rural hospitals to be eligible for financial aid under the CARES Act that we passed in Congress, that we see where small businesses in Main Street America are beginning to get funding. So I'll continue working with my colleagues in the administration, make sure that these care centers can keep serving our communities, and they do need attention, and we're going to continue to watch that and help them to all the extent that we can. And maybe the doctor might want to jump in on that also.
Hi. Yeah, I mean, the small hospitals are definitely something that we need to pay attention to. As you correctly said, the small hospitals typically have fewer resources to deal with. But as the Congressman said, we are really in an unprecedented crisis. I mean, there's no other word for it. And so part of what we wanted to do was we needed to maintain as much as we could the supply of what's called personal protective equipment. And by that I mean medical-grade personal protective equipment, or people call it PPE. So, for instance, if you're a doctor or a nurse, or you're really just working in an area where there's COVID-19 patients being taken care of, especially where there would be something like an intensive care unit where they would be intubating people and putting them on ventilators, that's the place in which you need very, very high-grade personal protective equipment to keep yourself from getting sick. And, of course, we want to protect our healthcare workforce to keep from getting sick, because we need them there for us in case we do get sick. So it became very clear that, among other things, the normal global supply of much of the critical PPE begins in China in the Far East. And the COVID-19 disrupted that supply chain. So while the supply was going down, the demand was actually going up. And, that's just the most critical situation that you can deal with. So we asked, the governor asked that folks refrain from engaging in, if you will, elective surgery. In other words, medical procedures that weren't necessary to stave off some serious medical complication or even death in a short period of time, so that the personal protective equipment that would normally have been used in an operating room or in a procedure room to undertake those elective procedures could be conserved and then supplied to the folks who have got those most critical patients and most critical needs. So it is a sacrifice. There's no doubt about it. I would defer to the Congressman to talk about what relief the federal government could provide, but I tried to outline, if you will, the rationale as to why it was necessary to cut back on a lot of procedures that normally would be taking place, because we want to keep our hospital intensive care units open, our hospital beds open, and we want to keep our healthcare workforce on the job.
And let me just add one more thing. I think I touched on it, but the Paycheck Protection Program, which is ramping out now, we're working hard to hopefully include some of our rural hospitals in that, so they'll have some money to keep their employees and not have to let them go. So we got all that in the works, and the farther we go into it, the better we're going to get. So that's in the queue right now to help the hospitals.
Thank you. And again, if you have a question, please press 0 and we will get you in the queue. Now let's go to our next caller. We have Jonathan in Austin, and Jonathan had a question about direct payments. Jonathan, you are live.
Hey,
hi,
Jonathan.
Congressman. Hey, how are you doing?
Good. Thanks.
I heard that the direct deposits have been going out starting today, apparently, and my grandma hasn't filed a tax return in a while. And I was wondering, I heard somewhere that they are going to have to take extra steps to get their money, and I was wondering if that were true and what we need to do to make sure that she gets that money.
Well, it's important that your grandmother get that, and that's a great question. And the IRS actually resolved that issue shortly after it came up. And I want to be clear that seniors on Social Security do not have to file a tax return or take any additional steps to receive the payment. The money will go straight into her account like it does when she normally receives benefits. And I also want to let folks know that if you're not on Social Security and you don't normally file taxes, the IRS has created a new portal to help determine eligibility and where you can enter your payment information. So I would say, too, to all of you, visit irs.gov/coronavirus to use that new tool. But she'll get that money, and if it doesn't come fairly soon, call my office, and we'll try to see, make sure everything's okay with your grandmother.
Thank you. And to everyone on the call, your feedback is very important. And so before we go to our next question, we would like to ask you to weigh in on a poll question. The question is this: do you think people need to start going back to work now? Press 1 on your phone if you believe people should begin going back to work. Press 2 if you believe Texans should continue to stay home. Again, do you think people need to start going back to work now? Press 1 if you believe people should begin going back to work. Press 2 if you believe Texans should continue to stay at home. Thank you so much for weighing in. We're going to take our next caller. We have Alan in Austin who is next, and he had a question about those with antibodies. Alan, you are on the line.
Thank you very much, and thank you, Congressman and Doctor. So there's been excitement about people with new tests coming out to test for antibodies, and that the people with these antibodies can go back to work because they're essentially immune to COVID-19. Can they become carriers and unknowingly give it to people at home when they come home from work?
Doctor?
Absolutely, Congressman. That's a great question. The short answer is no. If you have had COVID-19 and recovered and developed antibodies, and antibodies are one sign of immunity. They're not always perfect, so that's the thing I would keep in mind. It's not absolutely perfect, but right now in Texas, we believe we have about 2,269 people that have recovered from COVID-19. So keep in mind, you're not going to get those antibodies and you're not going to get that immunity unless you've had it and recovered from it. And that's a risky thing because we know how serious COVID-19 can be, and it would be unwise, in my opinion, for anyone to knowingly expose themselves to COVID-19 so they could get over it. While it is definitely more devastating in the more elderly you are, the more underlying serious medical conditions that you have, things like heart disease and hypertension and asthma and chronic obstructive pulmonary disease, those are going to increase your likelihood of a bad outcome. It could cost you your life. But we also have evidence of young, fit people who, for reasons that we don't really understand, that may be connected just with their own personal biological makeup. We have young, healthy people who have succumbed, who have not survived their COVID-19 infection. So going out and getting infected would be an extremely risky thing for someone to do. But we know that people form antibodies. There's some tests for the antibodies, but we don't know exactly how protective they really are. And that's a subject of intense scientific scrutiny. Everybody wants to know the answer to that, so it's a great question.
Thank you, Alan.
Thank you. Our next question is going to come from Tom, and Tom had a question about the Paycheck Protection Program. Tom, you are on the line.
Hi, Congressman.
Hey, Tom.
I'm a small business owner and really working to get access to the payroll protection plan. Unfortunately, I used Wells Fargo, and they were blunted from receiving much funding for PPP. And because of this, we've had to go out and seek funding from other banks. But all the banks want borrowers to have existing business accounts that were pre-February 15th. And so we're all caught in this kind of a catch-22 where you don't have access to a bank. Is there anything that you can do to help with that?
Well, yes, that's a great question. Have you gone back? Is Wells Fargo your bank?
It is. They are, yes.
And when was the last time you spoke to them?
Today.
Today, and they told you they were not doing they weren't working the program?
Yeah, they said that they had gotten into trouble with their
I know about all that.
And
yeah.
so right. And so they said that their funds were blunted.
Okay, well, I'm going to say two things. There's a bank called One World Bank. I guess you can go to their website. They have told us that they will take people that don't necessarily have a bank or they bank maybe at Wells Fargo. You might think about that, One World Bank. And if that becomes a problem, call my office and let's see if we can help you, okay?
Our employees working and out there doing their thing, but it's been tough, as everybody knows.
Well, if you will, if I would suggest One World Bank, and if that doesn't work, call my office, see if we can help you.
Sounds great. Thank you so much. I will do that.
Yes, sir.
Thank you.
Thank you. Thank you, Tom. And next we'll be moving on to another question. Our next question comes from Rick in Marble Falls, and Rick has a question about the relief check. Rick, you are on the line with the Congressman.
Hey, Rick. Rick?
Hello?
Do we have you on the line?
Yeah.
Hello?
Rick. Yes, sir.
Congressman, I'd like to, first of all, thank you for taking my question. And second, I'd like to know what you think about all the money that we spent. We spent trillions and trillions of dollars, and we are currently in an economic recession. And I was wondering what you thought about how much money we're spending and how that's going to really affect the economy, because I know the virus has caused this, but I also know that all the excessive spending has caused me some concern because I'm a conservative.
That's a great question, and I'm a conservative, fiscal conservative, one of the few that is really, really worried about our debt. Before this started, we had a $23 trillion debt. Now we're putting $2.2 trillion in the economy to get it going again. So I think it's a serious concern. But I will tell you, this incident that we've come across, we had to do something to infuse cash to protect our small businesses and, frankly, protect jobs. If you remember back in January, we had more jobs than people. We had 3% unemployment. We were talking about 4% growth. And look what's happened in just a small amount of time. So I'm concerned about the debt like you are. This is something I think we had to do to, like I say, keep our business and our economy going. We get our economy going again, I think it will come back like it was maybe hopefully in the fourth quarter if we can get America open again. We can begin to bite on the debt. But, again, as you know, like you do in your business and your home, we've got to be able to cut expenses. And we're not very good at that, and we've got to continue to focus on that. But I think it's important we get our economy going again, and I think President Trump's done a good job of doing that. This is an extraordinary event for our business called America. We had to fix it. Now we've got to get it fixed and go back and pay for it.
Thank you so much for that question. Our next question is going to be from Lisa in Dripping Springs. And Lisa had a question about recommendations on how long we'll need to work from home. Lisa, you are live with the Congressman.
Thank you. Thank you, Congressman and Doctor. I appreciate it. I was just checking on if the current recommendation is still to continue to work from home for those of us who are fortunate enough to be able to do that.
Is your question how long?
Is the recommendation in Texas to continue that for this imminent time period? Well, I know you don't know how long.
Yeah. I'll let the doctor touch on that too, but Governor Abbott has been clear that he wants to get Texas open as quick as he can, much like I do, much like President Trump does. But we've got to do what we're told, right? Texas has done a good job at that. So I don't know how much longer. I would bet that we're kind of beginning to see some daylight, but maybe the doctor might add a little something to that too.
Yes, absolutely, Lisa. That's really the question on everyone's mind, including folks like me in public health. We realize that this is a hardship, and we want to look for circumstances that will allow us to selectively maybe ease some of the difficulty and burden that's caused by the social distancing that I was talking about. So the one thing that's in favor, if you will, of social distancing is, boy, it works. It definitely decreases the number of times we encounter one another in a way that could spread any kind of respiratory virus, including COVID-19. And as the congressman was saying, and as I've seen for myself, we're seeing that doubling time for the amount of virus increase, which is good. In other words, it's taking slower and slower time to double itself. But that means it's still increasing somewhat. It's the rate at which it's accelerating is less, but it's still gaining momentum in our society. And so the greatest question right now out there is to say to ourselves, what is the right solution? How do we strike that right balance, thread the needle, if you will, between keeping things in place that are going to slow the spread of COVID-19 versus allowing a lot of business activity, economic activity to return. And, of course, we all know, the economy is not about money. The economy ultimately is about us being able to provide ourselves, each other, with the goods and services that we need to live and the things that we have enjoyed so much abundance in this society. So we want to return to that as much as we can. But how do we do it? What is selective? So we're working on that very hard to figure out, are there some industries, some parts of the economy that are more easily relaxed? Anytime we relax it, though, we're going to have in place very, very timely and robust ability to test, so that if we let the pressure off and the disease begins to spread at a rate that is unacceptable, then we would need to put the pressure back on again. And we don't yet have that much testing capacity widely dispersed so that we could catch that, we could measure that. Because, we're still dealing with something that I guess is, again, akin to a forest fire. I mean, you're saying, okay, we're starting to get it under control, but it's not completely out. But you don't walk away from it until you're sure that it's under control and that you know how to control what's going to happen in the future. So we're still at that point. I think it's some weeks away for us to begin to see clearly that the evidence, the very hopeful first signs that we're seeing are going to sustain themselves, that we're actually on that part of the curve where we're beginning to push back against COVID-19 and we're beginning to win the battle. And then we can really look around us and say, what are the opportunities that we have to loosen some of the social distancing, and the social distancing part is clearly the most painful. We are going to, even if we find ways to do that, we're still going to have to maintain some form of social distancing. We're not going to just go back to the way it was before. We're going to need to protect ourselves. I think we're going to be getting used to wearing masks when we're around other folks. In particular, we're going to get into good hand washing habits. We're going to use hand sanitizer, and we're going to clean and disinfect surfaces that we touch in common. I think that's going to have to be a way of life in the United States and in Texas until someday in the future we develop a vaccine or we develop other kind of medications that we know are effective against COVID-19 and will be effective in a way that doesn't cause more complications than we would find acceptable. So Lisa, your question is the one that's on everyone's mind, and I can guarantee you that lots of people are working on exactly how to find that right balance to get us going again as a healthy economy.
Thank you for your question, Lisa. And again, if you have a question that you'd like to ask during today's telephone town hall, please press 0 now and we will get you into the queue. We are going to ask you to weigh in on another poll question. Are you concerned about the coronavirus in your neighborhood? Press 1 if you are concerned. Press 2 if you are not concerned. Again, press 1 if you are concerned about the coronavirus in your neighborhood, and press 2 if you are not concerned about the coronavirus in your neighborhood. Thank you so much for weighing in. Our next call is going to come from Amy. She had a question about test kits. Amy, you are on the line.
Hi. To Lisa's comment really quickly, I think that there are those of us who can easily work from home for our existing companies, and that should be something that should be encouraged wherever possible, because the fewer of us that go back into work that don't need to, the better. My question was about testing capacity, and I've heard it mentioned that testing is scarce. What kinds of actions is the congressman taking to get test kits into the district so that people can be tested?
Well, we're working closely with it, and the testing equipment is coming. Every single day we see more opportunity, and the numbers are unbelievable. 300 million gloves, 8 million masks, 3 million gowns. All this sort of thing is coming. The test kits themselves, I can maybe ask the doctor to talk about that, what the access they have to those are.
Yes, Congressman, and yes, Amy, we're working very hard. If you look at the numbers, and we have them on our website for the Department of State Health Services, so www.dshs for Department of State Health Services, dshs.gov/coronavirus. And we have a lot of the statistics there, and you can see what the trends are. So the trends are very much that, we're increasing the amount of testing that we're doing. I'm trying to look right here at today's numbers. So the total that were tested just by commercial labs in Texas was 125,745 people to date. In public health, it was another 7,483, and so that's pretty good. And we've been increasing the number that we have of those tests day after day. However, in order to get to that next phase where we would consider relaxing some of the social distancing, we're really going to want to have testing available that's very easy to obtain and very quick turnaround. All of those things are improving. The commercial labs have been improving their access. In Texas, if you have a physician and that physician can order a COVID-19 test, you can get tested, and we expect that to increase. There's also every day, I shouldn't say every day, every week, there's a new kind of technology that some laboratory corporation or other develops and then puts out there. So there's new testing capacity that's coming online. So that we're using even more than one different type of test, and that's good, so that we're not having to have all of our eggs in one basket, if you will. So things are progressing there. We definitely want to have very, very robust and easy and quick turnaround testing again, so we can go to this next phase where once we see, and it's not here yet, but once we see that we are bending that curve and we're pushing back hard enough on COVID-19 to put it into retreat at some point, then we're going to be able to work on ways and methodologies that we can use to kind of relax some of the social distancing that we put in place. But we can only do that safely if we can measure that we haven't let COVID-19 get the upper hand again.
And Doctor, let me add something to her question, which is very good. From a convenience standpoint, we have 8 drive-through testing sites in our area: Austin, Temple, Killeen, and one north of Burleson for convenience. So that's getting even better.
Right, and if I could add a little more about testing, just to put a medical spin on it, if you will. One of the things about testing is, in the context that we're in right now, where there's what we call community-based spread in many communities in Texas, which means it's for all intents and purposes, it's not everywhere, but it could be anywhere, I guess is the best way to look at it. So you never know who you're going to encounter that might, in fact, be a source of COVID-19. When you get in a situation like that, even if you were to have some kind of concern and say, gee, I want to go testing, and you get tested and it comes back negative, that's great. What that means is you're not shedding COVID-19 virus at the time they took the specimen. But if it's in your community, you could come in contact with it the next day and become infected. So one of the things for folks, doctors and patients, to really understand is that testing needs to be used in a way that really reflects the progress of the infection in the community, and it isn't a one and done kind of phenomenon. As COVID-19 spreads through our community, a single negative test is great, it's reassuring, but you may have a point in time later on when you develop symptoms and you need to be tested again.
Thank you. Our next question is going to come from Michelle in Rio Vista. And Michelle had a question about how folks can help. Michelle, you are live with Congressman.
Hi, Michelle.
Is there anything that citizens can do to help out in these hardship times without going against the social distancing and just to do our part?
Well, let me, this is Congressman Williams, let me ask that first of all and then let the doctor add his. But I think what we all can do as individuals is be positive. This is going to end. This is going to be under control. We're going to get back to living the American dream. And I think being positive has a lot to do with people's mental attitude, their mental, how they feel about themselves when they wake up. If we know we're a positive force to other people, I think that's a big deal. And I talk to my family about that. We talk a lot to our constituents, is to be positive, because this is the greatest country in the world we live in, and the response we've had to this, I think, has been phenomenal from our doctors, from the people of America, our president and our governor and others. So I think being positive is one thing I would say. Have a smile on our face and not a frown. Doctor?
Congressman, absolutely. So one thing that is a resource for people to look at is there's another website that's www.texas.gov, G-O-V. And if you go on there, there's a number of things, and one of them is for volunteers. So if people want to register themselves as a volunteer, a lot of times what we're looking for are doctors and nurses and other people with medical licenses, but you don't have to have that. You can still say what you volunteer for. But I really think that the Congressman gave the very best answer, and that is think about how we've thought of ourselves maybe up until now as a country. We've been seeing ourselves as we can't agree on anything. We're so fractured. We can't find common ground. But that's not true, and that should give us great hope. We are finding common ground in the way in which we're responding to COVID-19. I think it's amazing. This is an incredible sacrifice that everybody's making, not just for themselves, but for the sake of others. And if there's anything that is the most highest civic virtue that I can think of. We are living that out right now. You are seeing the evidence of that everywhere, and that should give us hope. You know, one of the things is the congressman asked me to participate in this town hall because he wants you to know the truth, and your leaders want you to know the truth about COVID-19. And free people armed with the truth will always make wise decisions, even if they're difficult, even if they require sacrifice, but they will make wise decisions. And I would just ask you to look at how we are doing it as a free people, the success that we have, and compare it to other countries where, in many ways, the kinds of measures that were put in place for what you could politely call social distancing, I guess, in places like China, where it wasn't voluntary. It was not a cooperation kind of a thing. It was close to martial law, frankly, in many cases. We don't need that. We're free people. We have the truth. We're making wise decisions, and you can see it every day. So I would agree completely with the congressman that hope and that optimism and that attitude is the most powerful thing that we have as a society.
Thank you. Our next question comes from Hannah in Burleson, and she had a question about medical supplies. Hannah, you are on with the congressman.
Hi, Congressman Williams. I was wondering what the government is doing to get supplies to hospitals and clinics that are running low right now.
Well, there's the numbers are getting better all the time. I mean, just in Texas alone, we have 20,000 hospital beds available. We have 2,448 intensive care units available. 7,800 ventilators are available. And across the country, there's even states like Washington and some others that have found out they don't need the ventilators that they thought they needed, and they're giving them to other states. So the private sector has gotten very much involved. Once the private sector got involved, everything from masks to gowns, you name it, ventilators, we begin to build our surplus up, and companies like General Motors and Ford and Chrysler and other companies have jumped in to make these supplies. So I think it showed the greatness of this country. It kind of reminded us when we looked at the World War II days when plants were converted to make airplanes and bombers. We saw the same kind of attitude. We see the same kind of attitude now in our country. So a lot is happening every single day, and more people are coming online. In fact, we have in our district a company that makes tents, and they called me the other day and they wanted to convert their line to make surgical gowns. So I think the more and more we get into this, the more and more supplies we do have, so we don't have a shortage. And Doctor, if you want to add to that too, please.
Congressman Williams, you're right. The government's doing several things. At the federal level, they're really trying to, encourage innovative domestic production of the things like the personal protective equipment and other medical supplies, things like ventilators. So we've got plenty on hand, and that's ramping up. The other thing that they're doing is really trying to reestablish the trade route, if you will, from factories overseas, and they're meeting with some success there. Here in Texas, we have a couple of, up till now, one of our biggest sources had been supplies of personal protective equipment and other, so the masks and the gowns and that sort of thing, that were released from what's called the Strategic National Stockpile. And then we have a system in Texas that is based really on things that we set up for previous emergencies. So things like hurricanes and forest fires and that sort of thing. So a system of regional advisory councils that are the emergency care providers, the hospitals, all of those things organized together. We have stockpile's not the right word. What am I looking for? Storage space, warehouses is the word I'm looking for. Warehouses, climate-controlled warehouses in multiple places around the state. And then the hospitals and folks like that can submit a request for aid for various types of this material that's available. Again, like I explained before, we're in a tough spot because the supply has gone down while the demand has gone up. So I wouldn't want to tell you that we have everything that we would like to have, but we are managing to keep those most critical functions working, and as that supply increases, we're going to enable it, more and more of it to be available and be able to provide it to more and more folks like local emergency